Let's continue our discussion on visual diagnosis, inspection. Today, let's talk about body movements, head tremor, neck rigidity. Visual diagnosis of a person's movements. A person's body movements are one of the first things, along with the shape of their body and their posture, that we notice when they enter the room. It is important to be aware of how they move, not only before they sit down in the chair, but also after they have seated themselves. We should observe how much movement there is in the body or whether there is a distinct lack of movement. Heat and cold will both have an influence on a person's movements. The more heat there is, the greater the activity of qi, and thereby the faster the movements and the greater the amount of movement. A person with heat will not only move quickly, they will also tend to be more restless or just move their body more. A person with a lot of heat, both deficient and excess heat, will have difficulty sitting because their chi is agitated. Their toes will tap, their arms and hands will constantly be in motion, and they will keep moving about on the chair. This is usually noticeable in people with yin deficiency heat or yin empty heat. They will often be restless and nervous in their movements, having difficulties sitting still. The difference between deficiency and excess heat can be seen in, amongst other things, the force of the movements. Excess heat will manifest with more powerful movements because there is simply more qi. Yin deficiency movements are typically more fidgety and nervous. To gain an impression of how yin deficiency or yin empty heat movements can manifest, think about how small children are in the evening, especially when they are overtired. Their movements are not lethargic and slow as would be expected when there are qi deficiency, due to them being tired and exhausted. Instead, their movements are frenetic and overexcited. The more tired they are, the more they run around, and the more excitable they become. The dynamic nature of cold is to contract and constrict. There is thereby This thereby restricts the movement of qi, leading to a lack of movement and slowness. The slowness is accentuated by a lack of physiological heat, which can activate the qi and thereby the body itself. There will be significant differences in the person's movements depending on whether the cold is deficient or excess in nature. When there is yang deficiency, the movement will be slower and more lethargic. This reflects that there is a lack of yang qi that creates activity. With excess cold, the movements will also be slow, but the movements are not weary, weak, and feeble, but stiff and inhibited. This is because the lack of movement is not due to a lack of qi, but because qi is restricted in the movement by the cold. A localized invasion of cold will affect the mobility of that area of the body. Invasions of cold are typically seen in the joints of the limbs, the lumbar region, or the shoulders and neck. These areas will be restricted in their movement, and there will also be stiffness and physical pain. Blood stagnation can also result in a joint's movements being inhibited and often painful. This will manifest with rigidity and a reduced mobility of the joint. Elderly people's body movements are characterized by the decline in their yin, yang, qi, blood, and essence. This will manifest in the movements that are slow and weak. This, though, is not the only thing that we see. Elderly people's movements are also stiff and inhibited. This is because there is an increasing stagnation of blood and phlegm as people get older. Typically, Their movements will be the stiffest in the morning and after they have been sitting still for a while. They have difficulty getting up and moving again due to stagnation. Liver qi ensures that qi in the general can flow freely, and the liver thereby ensures that the unimpeded flow of qi throughout the body and through all the muscles and tendons. If liver qi is harmonious, the person will have a smooth and fluent movements. If liver qi has stagnated, the movements will be more uneven, clumsy, and stiff. Liver qi stagnation may also result in stiffness and innoticeable rigidity to the body itself. The person may sit stiffly upright in the chair and there will be a conspicuous lack of movement in their body. This will particularly be seen in the hands and facial muscles, which will be noticeably immobile. Qi deficiency and yang deficiency can result in a person's movement being limp and weak, the muscles lacking the energy to complete their movements. When the person enters the room, they may drag their feet slightly. Their movements will seem lethargic and will often be slow. Again, it can help to conjure a picture in your head. These are the movements that you will also see when someone is completely exhausted. Dampness and phlegm result in a heaviness in the body, and this will be reflected in the movements of the body, which will be lumbering and ponderous. The phlegm and dampness can also block the joints in the limbs. The movements of these joints then become stiffer and inhibited due to qi being blocked in its movement by the dampness and phlegm. This will be more noticeable when the weather is damp or humid and when the joint has been inactive for a while. Clumsiness can arise either because there is stagnation of qi, so that the movements of the body are uneven and rougher, or when there is phlegm. Phlegm can block the shen so that there is a poorer coordination of the body's movements. All of these movements are things that we should be picking up on as the patient enters the room and sits down in the chair. We should also be conscious of their movement once we interview them again when they get up to walk over to the treatment couch. We should constantly ask ourselves, what are their movements like? Are they slow, quick, or stiff? Do they drag their feet? How is the balance of chi and where is it in the body? Is there a lot of body movement in general or is it too little? Are the movements large or small, forceful or weak, rapid or slow, smooth or jerky, stiff, heavy, and ponderous? How much do they use their hands when talking? Do they sit too still? And if so, is it due to rigidity or lack of energy? Do they fidget and move about in the chair? If they are fidgety, is this due to nervousness or is it just movement? We see this often in children because children are generally warm and tend to be yin deficient. This means an excess of movement will have more diagnostic significance in adults than it does in children because the heat and relative lack of yin is the norm in children but not in adults. We should also note whether there are changes in their movement when they talk about different subjects. Here's a table showing the different body movements and their significance. If the body movement is rapid, it indicates heat. If it's quick and nervous, it is empty yin deficiency heat. If it is quick and forceful, it is excess heat. If the body movement is restless, it also indicates heat. If the body movement is slow and stiff, it indicates cold. If the body movement is lethargic and weak and slow, it indicates Qi deficiency or Yang deficiency. If the body movement is stiff and limited, it indicates cold, Qi stagnation, or blood stagnation. If there is clumsiness, it indicates liver Qi stagnation or phlegm. If the body movement is heavy and ponderous, it indicates dampness and phlegm. So now let's discuss about the head. Let's talk about tremor of the head. Tremor of the head consists of shaking of the head, with the head usually moving back and forth. The tremor ranges from the very slight with a small amplitude to the very pronounced with large amplitude. For its clinical significance, a tremor of the head always indicates internal wind, which itself stems from the liver. Liver wind may be of the full or empty type. The full type develops from liver yang rising or liver fire, while the empty type develops from liver and kidney-yin or liver blood deficiency. The tremor of the head is pronounced in the full type and slight in the empty type. In a few cases, the cause may be exhaustion of Heart-Yin, in which the tremor will also be a fine one. So here we have to remember a fine tremor may be due to the heart, and heart 7 is an important point to treat tremors also deriving from the liver. Now let's discuss about the full condition. In liver wind, tremor of the head, vertigo, tremors, severe dizziness, tinnitus, headache, numbness of the limbs, tics, stiff, deviated, or moving tongue, and a wiry pulse. So here we have to use in acupuncture liver 3, gallbladder 20, do 16, SI 3, bladder 62, and do 19. Next, we have the empty type. It's empty wind from blood deficiency. The symptoms will include slight tremor of the head, slight tremor of the hand, facial tic, dizziness, poor memory, blurred vision, pale and thin tongue, choppy or fine and slightly wiry pulse. For acupuncture, we use liver 3, gallbladder 20, do 16, SI 3, bladder 62, do 19, liver 8, stomach 36, spleen 6, and Ren 4. For empty wind from yin deficiency, it will manifest with slight tremor of the head, slight tremor of the hand, dizziness, tinnitus, night sweating, tongue without coating, a floating, empty, or fine and slightly wiry pulse. Here we use in acupuncture liver 3, gallbladder 20, do 16, SI 3, bladder 62, do 19, liver 8, kidney 3, kidney 10, spleen 6, and Ren 4. Now we have here rigidity of the neck. Rigidity of the neck indicates that the patient finds it difficult to bend the head forward or backward and to turn the head from side to side. Its clinical significance. In acute condition, situation may indicate an invasion of external wind, in which case it will be accompanied by all the typical manifestations of an exterior invasion, such as aversions to cold, fever, headache, and a floating pulse. Both wind cold and wind heat may cause rigidity of the neck, but it is more likely to occur in an invasion of wind cold, In fact, it is one of the chief symptoms of invasion of wind code as listed in the discussion of the code-induced diseases. Another possible acute condition causing stiffness of the neck occurs when the external cold and dampness invade the muscles of the neck, in which case there is also pronounced neck pain. This is a case of acute painful obstruction syndrome, and it is relatively common. In chronic cases, stiffness of the neck is due either to a weakness of the bladder channel in the neck occurring against a background of kidney deficiency or to internal wind, both of which are more common in the elderly. So to summarize, rigidity of the neck will show or indicates that there is an invasion of external wind, showing aversion to cold and a floating pulse. If it's an invasion of external cold and dampness, there will be rigidity and pain. If it is caused by bladder and kidney deficiency, there will be slight rigidity and dizziness. If it is caused by internal wind, there will be pronounced rigidity and vertigo. So as for the clinical note, the distal points for rigidity of the neck are bladder 60 and SI 3. Thank you for your attention.